And again, if you're just joining us or simply watching the CBS News Report, the GOP health care bill has passed, as Scott just mentioned, called Trump Care by some now. We're expecting a celebration and a news conference at the Rose Garden at the White House, which the president himself announced in a tweet a short while ago. We want to join Major Garrett, our chief White House correspondent. Now, Major, we saw the vote pass. It was as expected, the 217 votes instead of just the 216 needed. But if you're an American at home right now with Obamacare, what does this mean for you at this point?
Well, it means if you have grown accustomed in any way, shape, or form to insurance that you've acquired, either through an individual exchange marketplace in your state or through some of the protections provided by the Affordable Care Act, otherwise known as Obamacare, in the company-based insurance you have, meaning coverage for pre-existing conditions, no lifetime limits, and some of those guarantees that may have made your insurance more expensive, but also more elastic in terms of coverage. All those things are now up for grabs. They are in jeopardy. They may no longer exist, and they may be replaced by a different set of insurance standards, a different set of insurance products, maybe with lower premiums, maybe not, maybe with higher deductibles, maybe with lower deductibles. Maybe there's coverage for things you need and coverage for things that you can target and obtain on your own and not pay for things you don't need. That's one of the promises Republicans made. But if you have grown accustomed in America to insurance coverage, either guaranteed through the coverage you have at work by the Affordable Care Act or that you've purchased in your own policy on the individual market, those guarantees, those policies are now totally up for grabs. And you must watch what this Republican-led Congress and this Trump White House do to refashion the health insurance market in this country to find out what you can acquire, at what price, and at what level of coverage. Because if you've grown accustomed to this world of Obamacare and like it, those things are up for grabs. If you've grown accustomed to Obamacare and don't like it because your premiums have gone up or your deductibles are so high that the coverage really is there only in name only, you're going to get a chance to see what the Congress and this president will do to change that. So that's what life is for Americans in the insurance markets now. Largely speaking, up for grabs.
Major, one other thing we've been talking about all day is this idea of a win for the president right now with the passage here in the House without even having the Congressional Budget Office report and the numbers out there. How important was that win for President Trump?
Well, I'll tell you this. The most candid assessment you get from people here at the White House is this is less a victory achieved and more a catastrophe averted. And by that I mean the sober and serious-minded people here at the White House know that passage in the House is but one step in a long and possibly torturous process to rewrite the Affordable Care Act, pass it through the Senate, combine that bill with what was passed in the House, and finally get it to the president's desk. That is not going to be a short process. It could be weeks, it could be months. But here's the catastrophe averted from the White House's perspective. If the House Republicans had not voted to do this, then the entire issue itself would have died. And 7 years of promises from Republicans to repeal and replace the Affordable Care Act would have died with them. And if there's one thing this White House came to believe, is that if the Affordable Care Act was not changed and changed fundamentally, they could possibly lose their House Republican majority because activists, conservative voters, and the base of the Republican Party, which has consistently said, we want the Affordable Care Act changed, and if you can, repealed in totality. If that didn't happen, those voters were going to stay home. And that was becoming a greater and greater political concern at this White House. And so every effort in the last 3 or 4 weeks has been invested to reviving this, working out the differences, and getting it through the House to live another legislative day in the Senate. So, less victory achieved, more catastrophe averted.